the self is, I'm particularly interested in the functions of self-reference in cognition and behavior, and how self-reference affects information processing. We test these issues based on self-polarization effects. There's much evidence indicating that people are biased to self-related information. This is known as a self-polarization effect or self-bias effect. For example, people are faster and more accurate to judge their own faces and objects compared to the faces and the objects belonging to others. And their memory tends to be better for stimuli that are encoded in relation to themselves than in relation to others. And these biases are pervasive.
Dr. G.
Can you hear me?
We can hear you. Can you share your slides? We are not able to see the slides, please.
Sorry. It's my fault. Sorry, I just forgot.
Yeah, that's
okay.
Good.
My apologies for this.
Yeah, go ahead. Thanks.
Okay. So we just talk about the self-polarization effect. It didn't miss anything. So that's the first slide. And then second, I just talk about the self-polarization effect here. But the nature of these effects is not very understood. And is it an effect on perception, on memory, or on high-level social processing? Is the effect due to familiarity of stimuli, or something special about the self? What are the relations between self-biases and the basic underlying processes, such as reward and emotion? To address these issues, and my work covers 3 parts. First, I'll talk about a new approach to measure self-biases. And second, I'll talk about a neural framework of the self. Finally, we'll look at a little bit future, several directions of that work can be taken in. We develop a new approach to measure aspects of the self, and it's built on association procedure, in which participants had to associate neutral geometric shapes with 3 people. For example, a friend associated with a square, a self, a circle is you, and a triangle represents a stranger. After forming the association, people are shown either the same shape label pairs or repaired shape labels, and they were asked to make a simple yes or no response. What is your prediction? Would people immediately favor neutral shapes associated with themselves, and then others? Here are the data. Reaction time against accuracy. What you can see is that the red dots represents the self, blue the friend, black the stranger. And they were faster and more accurate responses to the self-associated pairs, and then the pairs linked to other people. And this is a massive self-polarization effect. And bootstrap analysis demonstrates a clear boundary in responses to ourselves and others. And this means using a very simple perceptual matching task, we are able to measure self-biases by separating the responses to ourselves and other people.
Dr. Sui, can you make the slide to slideshow? That will be a little bit easier. A little bit
bigger?
Yes,
something?
yeah.
Okay, yeah. Okay.
Thank you.
No problem. So one interesting aspect of this effect is that the bias is stable within individuals over time. And the left figure illustrates data collected in 2 occasions, which took place 1 month apart. Individuals who show a stronger bias on time 1 and those on time 2. So if we put the data together, and cluster analysis demonstrated that the self-associations across testing sessions form one cluster in right. However, clusters for other associations are determined by context, then time 1, time 2. And the data show the stability of this measurement. It provides the evidence for a treat-like measurement of self-processing. There are other interesting properties of this measurement. One is that the effect size is large and the task is simple, which can be derived rapidly within 5 minutes. And this means that the measurement can be applied to a wide range of populations such as children, old adults, and patients. In addition, and the measurement is also open to detailed mathematical analysis. For example, so here is an example concerns a study of redundancy gains. Typically, responses are faster when we respond to 2 items relative to single items. We had people classify single or double self or friend shapes. Here, I present a formal mathematical analysis of the results in terms of processing capacity. And this assesses the probability of a response being made across different time windows on redundant trials, and then divided by the sum of the probabilities on single item trials. If this measure equals 1, then there's unlimited independent processing of the 2 elements on redundant trials. And if this measurement, the capacity, is greater than 1, then there's said to be supercapacity when processing on redundant trials is better than can be predicted from the sum of processing of single items. And this occurred for self-related stimuli, but not for stimuli related to the friend. And the results indicate that self-reference facilitated processing by bounding stimuli as a whole instead of the sum of the parts. And this work has generated both national and international interest. At least 30 labs that I know of are using this procedure, because it's not just a single paradigm. It can be transferred to different fields as associations are formed to simple features such as shapes, colors, which can be used in many different experiments. For example, on perception by manipulating the luminance of stimuli, joint action by manipulating the relationships between the players and the stimuli, and the social interactions in which the associations made with in-group or out-group members, and so forth. Recently, we summarized evidence and proposed a neural framework for self-bias effect. In the second part, I'll talk about this neural framework of the self. I try to make it a little bit bigger. Okay. So we argued that self-biased responses are mediated through a ventral network involving a self area, the ventral medial prefrontal cortex. And the ventral network reflects a bottom-up processing. In contrast, cognitive control is evolved through a dorsal frontal parietal network, reflecting a top-down control processing. And saliency networks, including the insula and the striatum, is also involved. The proposal is that these neural networks interact for control of behavior in the presence of self-related stimuli, and the interactions reflect the relations between the strength of cognitive representation and emotional responses relating to the self. And this framework has broad implications for understanding a wide range of disorders related to self-processing. Next, I'll focus on the evidence for the interactions between these neural networks. First, we asked if there are specific neural circuits to support self-biased responses. In the association task, matching self-pairs was associated with increased activity in the VMPFC and the left posterior superior temporal circuits. And the VMPFC is the center of self-representation in the brain, where the left posterior STS is a sensory-driven region associated with social attention. Importantly, dynamic model cultural analysis showed the best fitting model required strong connectivity from the VMPFC to the left posterior STS, and the strength of this functional connectivity predicted the size of self-bias in behavior. And this means that the tagging personal significance to neutral shapes affects perceptual matching by coupling internal self-representation through the VMPFC to the posterior STS, modulating attentional responses to external stimuli. In contrast, other matching responses were associated with increased activity in the dorsal attentional control network, and which is required to support performance in the more difficult task. And this dorsal system is not recruited in the self-association. Next, we tested what happens after the breakdown of the soft network in patients with brain damage. As an example, here I show the magnitude of self-biases, a positive value for controls, and the patient group falling within the range of controls. In addition, the patient sample included some who showed abnormally strong bias, a hyper self-bias, and some who showed abnormally low bias, a hypo bias. And the last pattern was associated with brain damage to the VMPFC and the insula, consistent with a loss of self-influence after brain damage to the ventral network and the saliency network. So finally, I'll talk about several directions that this rule can be taken in. One important question in the field is about the relations between self-processing and other basic behavior drivers, such as reward and emotion. One of the virtues of the association procedure is that it can easily be applied to examine other biases, not just those related to the self. For example, we have examined not only self-related matching, but also matching based on reward and emotion. In the case of rewards, participants link a shape with a monetary value and then receive a differential reward for correct responses. For example, 9 times more for the circle than for the hexagon. In the emotion case, participants associate a positive neutral emotion with a shape. For all of these cases, a strong bias emerges. Responses are faster to high than low reward, to positive than neutral emotion. And this raises the question of whether these biases are driven by the same underlying factors. There are various ways of looking at that. Let's look at one example. One approach to looking at the relationships between the biases is to examine if they dissociate at the neural level. Here, we have participants carry out a self and emotion matching in the scanner, and then use brain connectivity analysis technique to test if self and positive or negative emotion shared neural structures. We look at the VMPFC and the dorsal prefrontal cortex, the DFPSC, which are classically associated with the self and the emotion-related processing. As the left figure showed, the VMPFC is recruited in both self and positive emotion-related processing, contrast with other and contrast with the neutral. But this is not the case for the negative emotion processing. And then if you look at the brain activities in the dorsal DFPFC, then there is no discriminations of either self or emotion. In particular, functional connectivity analysis demonstrates that the interactions between the key regions across the default mode network, the VMPFC, and the saliency network, including the insular and the executive control network in the inferior frontal cortex, and the interactions and predict the strength of the self-positivity effect. So I won't elaborate details. I'm happy to talk more if you're interested later. There are other directions that this work can be taken in. One example concerns the relations between self-emotion and depression. So these are data from a longitudinal study to assess the sensitivity of self-association measurement in relation to mood state in individuals with low mood. And this figure showed reduced self-biases in perceptual matching task in depressed participants compared to healthy controls. Particularly, structural equation analysis revealed that reductions of self-bias effect with low mood state on time 1 and predicted the changes of mood states on time 2. And it suggests that self-bias may be used to index mood states with direct implications for psychiatry. Another example comes from study using the association matching technique with the young mothers to examine a range of personal relationships with associations made to the baby, themselves, their mother, their friend, and a stranger. So this is the data, so reaction time against the accuracy. What you see is that a clear improvement in performance from the baby in red and the self in yellow to the mother, to the friend, and so forth. However, the striking result is that the self-bias is lost in relation to the baby. And this is the first demonstration of the loss of self-bias in healthy population. And it correlates with the quality of the attachment rated by the mother to the baby. And this may provide a new way of measuring parent-child bonds implicitly. And another future direction is that we have applied the self-association approach to improving patients' cognitive capacities. As example, so we have used the self-association to improve patients' memory. And this was a single case study where amnesia patients with large brain damage in the hippocampus and the posterior ACC. And the figure shows the chance level performance in patients in both source memory and the recognition memory. We test whether the patient's amnesia could be reduced by having him make self-associations with stimuli. And the analysis revealed that there was 25% improvement in both recognition memory and source memory by linking items to the self. In conclusion, so I'm interested in the functions of self-reference in perception and cognition. I started with self-bias effect, talking about a new approach to objectively or implicitly measure aspects of the self. Then we talk about the neural basis of self-processing. We argued self-processing linked to specific neural networks for control of human behavior. Finally, I talk about the future directions of this line of research that can be taken in the broader context of psychology and neuroscience, from perception, cognition to developmental studies, psychiatric disorders such as depression, and neurorehabilitation. It remains to thank for our funders, our collaborators, and the lab members. Finally, I would like to thank you very much for your attention.
Thank you so much, Dr. Ji Sui, for sharing your wonderful research experience and the insights into the relationship between self and emotions. And I just wanted to give a brief introduction for Dr. Ji Sui. So Dr. Ji Sui is a professor and chair in psychology at University of Aberdeen. Her research, as we saw, focuses on self, social brain, healthy aging, as well as social interactions in the VR. She has numerous publications, which has brought a paradigm shift in the cognitive neuroscience research of self and emotional perception. And Dr. Sui, your presentation brought so many different questions, but one of them I would like to ask before we go into the Q&A that some of our audiences have shared. This is regarding the memory processing that you talked about, how when people with amnesia, their memory related to self-processing is better compared to non-self-processing stimuli. Do you feel is there an implication for the role of amygdala in these instances?
Okay, that's a really good question. For this single case study, actually, patients do get brain damage over several brain regions, and one is kind of hippocampus, a little bit amygdala, and also the region a little bit posterior anterior cingulate gyrus, so over that region. But none of key regions associated with the self, were damaged. So which means the patients also have, so that's based on the brain damage, and also based on the patient's reports, and the patients really have very intact sense of self. and he could report something related to self. He could repeat it, but nothing else. So that's why that gives us a little bit idea. Oh, the patient's no brain damage. The key brain damage is not related to self, and the patients could report all the important things related to himself. Then we think whether we could use the patient's the good sense of self to facilitate their cognitive deficits. So that's kind of the basic idea. But it's really difficult to, disentangle the different effects, between different kind of brain damage, like amygdala, hippocampus, and the posterior SCC. It's because it's impossible to separate sort of things. With a single case study, we hope we have more patients with selective brain damage in different reasons.
Yeah, that will be very fascinating to know when you start seeing different brain damages and how the self-related memory processing works. So I have a question from our listeners. Divya would like to know, so this is people who suffer from depression, why do they lose or forget about their real identity after suffering from depression for a long period of time? So this is related to people with chronic depression. How does it affect about their self-concept?
Okay, I would say this is a very important question in depression research, but I'm afraid I don't have answer for that, because based on our data, the evidence from our group, really using this perceptual matching task to test the changes for self-representation in depression, is because if you look at the paradigm, it's always like how people link the internal self with the external stimulus. For example, you are a circle, and then we calculate the participants' responses to the linkage between internal and external, internal representation with external world. And so that's why we found the reduced self-realization in depressed individuals compared to control. It's because for depressed individuals, it's really difficult to the healthy controls to have a normal linkage between internal self with the external world. I think that's our interpretation based on our evidence. But in terms of other aspects of the self, like high level sort of things, I don't think we have an answer for that. But thank you for the question.
Yeah, that has much more research work to do.
Yeah, continuous work.
Yeah, thank you, Divya. And then I have another question from Veena. She says, very interesting findings. Thank you for a great presentation. Are there any limitations of this approach that we should be aware of in terms of confounding factors?
Yeah, I think that if we can say something, the benefit of this paradigm, the one of the virtues of the paradigm is really we try to control the familiarity of stimuli. When you use the, for example, self-faces and your names, or it's kind of your belongings, you're really familiar with sort of stimuli. If you get effects, you cannot say it's because it's self-special, or it's just because the familiarity of stimulus. So we use this paradigm try to root out the familiarity effect. But on the other hand, so that means that lab-based study is not the real something. You could say you are a triangle. So that's kind of what ecological validity is also important. We hope we get one way to linking things together.
Yeah, thank you. And I have one more. Thank you for your very interesting presentation. This is from Jayashri. We see a lot of patients with dementia, and it is difficult for family members to see the loss of self. That's one of the things, along with memory, people do lose some pieces of their self. Based on your work in this area, what would you think is important to communicate to families?
Oh, that's a great question. We started to run aging research a few years ago, but it's quite a longitudinal study. We don't have a full data set to report. But at least one thing we could say, the changes in self-representation is well known in a number of psychiatric disorders and also brain disorders. I think what we found for healthy elderly people, and they usually show the maintained self-realization effect. So then they ask whether we could use the maintained cognitive capacity and that associated with self to facilitate, the healthy aging. So that's kind of one direction we use. But the key question is that even the old participants show the maintained self-processing, but it's because they are the similar neural bases, for supporting self-processing in old people, which is similar to healthy people. There's kind of compensational system. That's a very interesting question. We continue to run this lab research. Hopefully we find answer later.
Wonderful, thank you. I think, let me see, there's one more. From Varghese. Thank you for the presentation. Can you please tell the merits and demerits of using a perceptual matching task over self-related stimuli like self-voices to understand self?
Sorry, you mean the associations made to the self and the other? You mean the controls?
So, merits and demerits of using a perceptual matching task versus self-related stimuli, like using a self-voice to understand their own self.
Okay, you mean the labels for that? Okay, actually this is very interesting research, and a lot of research starts to use different kind of labels, you, self, me, sort of in yourself, actually usually found the similar comparable performance. I think that the self-positioning effect is not driven by the labels being used. It's because no matter what kind of label you use, which refer to the self, that really try to build up to trigger your internal self-representation. So I think I hope that's the question. It doesn't matter what kind of label you use, me, myself, use, yourself, you. Researchers always report a similar kind of performance, the self-partition effect.
Awesome. Thank you so much. We have a few more questions, but what we will do because of time, we will have to move on to our next speaker. Thank you so much, Dr. Sui, taking your time, valuable time to talk to us and share all your knowledge related to self. Thank you.
Thank you for the questions. Thank you.
So, and welcome again, everyone, for joining this 4th symposium on self and cognitive neuroscience. Now I'm going to turn this over to Ms. Chandana, lecturer. She's a lecturer in Department of Psychiatry, PSG Medical Institute. She is my co-moderator. Chandana, please take over.
Thank you, Dr. Kavita. Let me introduce the second speaker for today's session. Dr. Sanjay Kumar, who is a senior lecturer in cognitive neuroscience at Oxford Brookes University, UK. He completed his PhD from National Institute of Mental Health and Neurosciences, NIMHANS, India, and has worked as a postdoctoral research associate at the University of Oxford. He has a lot of research interest in the area of cognitive psychology, neuropsychology, EEG, ERP, and has done has published a lot of work in this particular area. His studies mainly focus on understanding how the brain extracts action-related information from the visual environment and the role of it in attention. And also he has explored the effect of brain stimulation in depression and understanding the neural basis of self-bias in psychiatric conditions using EEG and TMS. So it's a great honor to have Dr. Sanjay Kumar with us today. Now I request Dr. Sanjay Kumar to begin your presentation.
Thank you so much, Chandana. Let me start sharing. Can you see my slides?
Yes, sir, your slides are visible.
Okay, thank you. Okay, thank you so much for this wonderful opportunity. It's a great pleasure to be with you all. And it's a tough job following from Jesu's presentation. She has given a fantastic idea about what the self is, what it can do, and where all it leads us to. But I will try my best, and let's see where we are. My focus would be slightly more on the clinical side, as many of our colleagues who are listening, they are from the clinical background. So let's see if I can do justice to that aspect. What Jay was trying to indicate that we can characterize self in multiple ways. There are no single way that a self can be understood. And some of those more in the cognitive neuroscience field, it can be characterized as I versus me, narrative self versus experiential self, which are very much same as I versus me distinction, where me is much more prolonged kind of a development of self, and I is much more instantaneous at the moment, what we are feeling and what we are doing. Other idea of the self is much more like semantic memory system, that we acquire this self-information or idea about ourselves from multiple experiences in our life. So there is no single experience that defines who we are, rather than multiple experiences where all those episodes will define what the self is. So why do we need this understanding about self? In clinical psychology and in psychiatry particularly, we know that self is very critical for personal identity. It is critical for psychological functioning and psychological well-being, and therefore we need to understand what the self is. You might have come across borderline personality disorder patients. One of the characteristics that you might find in those patients that they have certain difficulty with their self-representation. And here, Otto Kernberg's idea or notion on the self is quite interesting, which suggests that people with a weak sense of self have an identity that is the consistency of a jello. It can be modeled into any configuration that contains it, but slips through the hands if one tries to pick it up. And you would see this kind of characterization happening in patients with borderline personality disorder. You try to pick their self, you try to build up their sense of belonging, but at times it just slips away. Not only in that aspect, but many of the researchers, they argue that almost all the psychiatric disorders can be conceptualized as a disorder of self. I can give you an example from schizophrenia. Schizophrenia is one of the functions that Jay talked about. It integrates information. But in schizophrenia, we have seen that there is failure of multisensory integration. Not only that, there is blurred boundary between the self and non-self, and that hallucinations and delusions where we say that it is their inability to make those boundary separation, or we call them as they are not in touch with reality. So that primarily is associated with the their expression or lack of expression of self. Depression, very much hallmark feature of problem with the self, and Beck's famous model of depression, looking into the negative triad, where it talks about the sense of self, or the negative view of the self, and future and the world are the critical components of depression. So here we are looking that the self is also coexisting with emotion. So what exactly these two things are doing together? There are plenty of research to suggest that there is very clear-cut interaction between self and emotion, and that shapes our daily experiences. If you are thinking, oh, if you have any positive memory or positive experience about anything, you will tend to have a stronger sense of mindness with that experience or object versus something with which you have a negative experience. So this valence determines the mindness quality of that object or experience. So here you see quite nicely how these two things are closely related. At the neural system, we saw in Jay's presentation that there are separable and common regions which are mediating self-related processes and emotional related processes. At the theoretical cognitive experimental level, you see that self and emotion, they will have almost similar kind of effect on cognitive processes such as perception and attention and memory. Memory will be enhanced in positive emotion. Many a times you see emotion-dependent memory formation happening, and that exactly same thing happens with the self-related processes. However, that is not always the case. Some have argued that self is not always needed to experience emotion, and particularly some examples are given. For instance, that if you are involved in any accident, you are quite fearful. It's not that yourself is fearful. It is that fear is so overwhelming that you lose the sense of self there. Right. Similarly, at times, any joyous situation like winning a lottery, it is not yourself who is involved in winning the lottery, right? So these kind of experiences may not require strictly the presence of self in that context, but that is not always the case. In most of the situation, we see very nice interaction between self and emotion, and what is called as self-conscious emotion. And some of those typical example of self-conscious emotions could be pride, shame, guilt, or these kind of feelings that one goes through. So experimentally, I was trying to see if self and emotion can interact. Jay Sui and Moitz, they have published this work in 2016, where they showed that self-processing and emotional processing, they do not seem to interact, or there is a separation of those processing. Their experimental paradigm was slightly different than what we are proposing here. Here we directly manipulated the presence of self and emotion in single experiment. And very much similar to what you saw, the shape matching, here we are changing that to a color matching. So we can associate a particular color to self or a particular color to a stranger. In this case, let's say yellow is to a stranger and this blue is to the self. Some trait words, a positive trait or neutral trait word were presented, and those trait words change their color after 150 milliseconds, and participants had to respond whether they saw a positive or positive trait word or whether the association was correct. In this case, yellow, which is related to a stranger, which is a correct association, or at times they were required to respond to both of these elements, whether the association is correct and whether that trait word is a positive emotion or not. Okay, so here all those three possible responses where we were trying to get into single experiment with single output method. Yes, interestingly, this is what we find. You can see with the positive emotion and the matched condition, this red line is for the self, we see that there is a very nice accuracy rate. However, we do not see that kind of accurate performance in other conditions. It seems almost flat. What remarkably you see here in non-matched positive condition to the self, that there is performance decrement. And this has been shown many times that it is quite difficult to dissociate from the self-matching ideas. So if there is a color and let's say you learned the association blue color to self, but with blue color, if it comes as a stranger, it is quite difficult to override that kind of association. And that's why we see robust performance decrement in those participants. Very much similar to what Jay has shown earlier. We did some modeling on that. And here you see, particularly in the self-related condition, just take for in simplicity purpose, here you see that there is a crossover, and here you do not see a crossover in other related condition. So what we take that as an evidence that in self condition, emotion is interacting to improve the performance. But in other condition, there is no interaction. Everything seems to be going in parallel. So in self condition, there is a violation of that race model, right? But we tested this further on with similar kind of idea you heard before with a coactivation model, that if there is any coefficient at 1 that indicates a parallel processing, nothing is interacting. If it is above 1, that indicates that there is a supercapacity. Those two things are interacting and they are facilitating, just not interacting, they are facilitating in those redundancy gain paradigm. And if it is less than 1, that means there is some kind of inhibitory mechanism or some kind of performance decrement is happening through that interaction. And what you see here nicely, a flip over for self and other processes. So with self, emotion is interacting, making it a performance supercapacitors, but with other, it is interacting in a negative way. So that nicely demonstrates that self is interacting with emotion and interacting for a positive effect. So how these kind of interactions, self-based interaction and emotion that happens in certain psychiatric condition, and there were some questions to Jay around that. I will possibly try to answer those questions. Let's see. If we think of what the depression is, two theoretical distinctions I can think of at least. One that focuses on the self. And Beck's model seems to me that it particularly focuses on self, where we talk about the negative self schema, which activates negative triad, which involves a negative, which is a valence, view of self, future, and world. Right, so that seems quite self-focused. But the alternative characterization of depression could be more in terms of emotion-related problem, where three different properties we can think of. One is that depression is associated with pervasive negative affect and anxiety. Second could be there is pervasive lack of positive effects. So these two are different things. In second, we are talking much more about anhedonia. And the third one, which is not robustly investigated enough in psychiatric literature, is about pervasive lack of experience of any effect. Okay, so you do not feel either positive or negative effects. Depression is not the experience of sadness, but what it could be the experience of lack of sadness as well as lack of experience of any positive effect. Okay, so what we call as emotional context insensitivity, or in simple term, we can understand that as emotional numbness, blunting that we see in many patients. So we try to test those kind of effect, whether how emotion and self would be represented in depression. Very much similar to Jesuit's paradigm, where we presented a shape. Let's say circle is associated with self and triangle is associated with a stranger. At the same time, we presented implicitly some kind of emotional stimulus with that. And those emotional stimuli, they were positive emotion, negative emotion, and neutral emotion. Okay, and simple idea whether the shape matches with the association that you have learned. In this case, circle matches with self, that's a correct association. Right. And this is what we find, that in depressed patients, you do not see happy self modulation. But in control, you see that there is a self prioritization happening with the positive emotion. Emotion is to some extent is also influencing in control participant, the sad emotion or negative emotion, the self prioritization. And we do not see those kind of effect happening at all in depressed individuals. Further on, we did some further analysis. I'm not sure if you can see these red dots, but you will have to trust me if you can't see. These blue representation, they are for the depressed patients, and the green representations are for control participants. In control participants, you see that this red dot, or where my cursor is, that is high from this 0 level, which indicates that there is a bias towards emotional processing, in this case, happy emotion, happy self-biased emotion. There is a little bit towards sad biased emotion as well, but in depressed patient, you see that it's at 0. That means any kind of emotion, either in happy or in sad, of those background emotional information. We do not see that so much in the other or a stranger condition. So it seems that when self is trying to experience any emotion, those who are experiencing depression, they flatly are not attuned to those emotional experiences. Everything for them seems to be quite neutral, quite bland. Right. So what we call this as emotional context insensitivity in depression, or I talked about the emotional numbness or blunting. This is freshly baked data, so there might be some inaccuracy. Just 2 days ago, I got this data from my students. Here again, we see a gender effect emerging in this emotional context insensitivity or emotional numbness. So here, in men, we see that is much more pronounced effect. So this positive effect, that means they are responding to neutral stimuli much better than emotional stimuli. Okay, And that distinction we see in this man when they are processing from self perspective. They are different from women to the self and from the control condition as well. So here we a kind of nice evidence is emerging that possibly men are more attuned to having those kind of blunting related responses. Obviously, this is a very small piece of work, but it gives some direction to take it further on. So whether these kind of effects we can still see before anyone can experience depression. And in literature, we know that there are certain personality characteristics that will make individuals vulnerable to experience depression, particularly those who are high on neuroticism, those who are low on extraversion. And if we combine these two, that gives an index of depressiogenic personality. And here, this is some easy work that we did with one of my master students. And here, what you see, we have looked at this lead positive component from the centroparietal region, we call as lead positive potential. And in this particular time window, those who had high predisposition to develop depression based on the personality profile, they had lower activity in this time window, and what we call as lead positive potential. Whereas those who had low predisposition to develop depression, they had high activity in this time window, which is quite remarkable that from the personality perspective, and if we can extrapolate that, we see at the brain level how this kind of depressionogenic personality can be manifested. And this self-related task seems to be quite interesting to identify those processes. We did a source analysis of those EEG waveforms in that time window where we saw that lead positive potential. What here you see in the low depression prone personality, we see activity in the parietal and precuneus region, the same region which Jay was talking about, the salience effect that emerges in the self-prioritization part. Or it is also associated with introspection. So we see that something is happening in these individuals. But the moment we see that there is high predisposition to develop depression, we see there is a shift of that activity from the parietal region to more frontal region. And if you remember from Jay's talk, frontal region seems to be more executive related, control mechanism driven, so more analytical kind of. So it's self-reflection seems to be getting lost in these kind of individuals, and possibly that may be a predisposing factor in itself to develop a depression. So here you can nicely now relate to the questions some of you asked, that how self can be used to understand a development of depression. Not only on those chronic pattern of depression, it's from a different paradigm, a different kind of investigation that I carried out on one patient. It's a case of psychogenic amnesia, and diagnostically we may call that as a psychogenic fugue condition. He was a 52-year-old unmarried, high school educated male. He had a past history of depression. He had gambling problems. And due to gambling problems, he had high debt, and bank sent him one day a very nice letter, Mr. So-and-so, we need to collect debt or we will send a bailiff to you. That was quite high stress-inducing situation for that person. And that completely changed. After the letter, he went for work, but he did not reach to his work. He was found wandering by public at a bus station. Public handed him to police personnel, and uh, he was found with a bus ticket for a different city with which he had no connection to. But and when he was asked who he was or where he lives, he has no idea. He was just wandering around, no familiar information, and he had severe amnesia for past 5 years of his life. So that quite circumscribed amnesia, and that is very typical presentation of the psychogenic cases. As I said, this was a different kind of investigation, but the notion that I'm trying to build up is it's same. Itself seems to be involved in mediating this memory mechanism, which might be emotionally driven. But here, of all those things, that recent past events, very he knew from last 5 years or so, only 2% he could tell that he knew anything about. Early childhood seems fine because they are time tests, so 9 seems to be fine. All the other memory functions seem okay because we were testing for episodic memory, new learning, everything fine. But the problem that we see that is emerging on 2 different tests, one California verbal learning test and auditory verbal learning test, it is the subjective clustering. That seems to be a problem. So how to organize material in a self-referential context, that is getting lost in these patients. Research has shown that psychogenic amnesia, you will see particularly left hemispheric activation, which suggests that there is a kind of detachment from emotional experiences. And there is no subjective or emotional experience to those events in these patients. And exactly that's what we see, that we see that there is lack of subjective organization. And as you would know, that subjective organization is very much person-centered. Every person has a different way to organize those materials. And that's what exactly we find in that patient, that he wasn't able to utilize his self-related processes to organize those materials. So, and that gives a quite nice idea that these kind of severe psychological trauma can also block expression of those emotional self. Right. So hopefully I have been able to give you some idea that how self is able to integrate various cognitive processes, and I focused on the emotional processes. Self helps to bind with emotional processing, and we saw that perceptual and attentional processes were much more improved. And psychological problems can affect expression of the self as well as its integration with the emotion. Hopefully, I have tried to give some answer to previously asked questions, and I'm sure there will be some more questions. I will be leaving a bit early, so I won't be staying back for all the last questions, but for the timing, I'm here. If you have any questions, or you can email me later on. Thank you.
Thank you, Dr. Sanjay, for a very wonderful presentation on how emotion and self interact with one another. And it was very fascinating to know a lot of interesting experiments that have been done in this particular field. We are waiting for the questions to come up in the chat box. Meanwhile, Dr. Sanjay, I was wondering, like, as you were talking about emotions, the relationship between emotions and self, how they interact with one another. Emotions are very intense and specific and very short-lasting events. So I was wondering about the mood of the person, like say dysthymia. The people who are more prone to have a depressive episode. So does mood have a role to play in the self, or between the interaction between self and emotion?
Yes, you can conceptualize mood as a prolonged, a certain kind of emotional state, a more pervasive emotional state in a similar way. What we are doing here is that we are taking a snapshot of that pervasive affective state. We are calling that as an emotional state. So, and we are just trying to extrapolate from the emotion to the mood. You can argue in that sense. Yeah, but you're right that we are particularly looking at the emotional state, taking that as a surrogate marker for the pervasive mood state.
Okay. Okay, sir. And yeah, we have several questions in the chat box. This is from Jalesh Panikya. He has asked about patients with functional neurological disorders, often present with a bizarre constellation of neurological symptoms. Could the lack of integration of self underpin the patient's lack of voluntary control of their symptoms? And fMRI studies seem to suggest networks in the ventrolateral prefrontal cortex to be affected, overlapping with the networks discussed in the earlier talk.
Yeah, indeed. Yeah, there are literature around that which talks about the attributional biases in functional neurological disorders. So how those attributional biases develops at the first instance, just think about the depression related Beck's idea, the negative schema that develops gradually. That triggers those negative automatic processes related to self and future and the world. In similar way, even the experimental evidence in functional neurological disorder, they have shown that there is particularly a problematic attribution bias that is operating in these individuals. And because there hasn't been any particular study related to the self, what I can think about that those attributional biases might be driven by those their internalized self mechanism. And precisely for those reasons, the activity that Jalesh talked about, they are found in primarily those regions which are attributed to the self processing.
Okay. Dr. Sanjay, we have one more question in the chat box, and interestingly, this is from our next speaker, Zargol Muradi. She has said, thanks, Sanjay. I like to know more about how self-reflective processes fail in depression. Is it the case for major depression, or less severe cases of depression also show similar symptoms?
So if you remember from Jesui's talk, she has shown the model based on the BDI scores. So there seems to be some association between the BDI score and the self-referential biases that you might see. So different degree of the depression level might be affecting self differently. And that would be intuitive thinking too, that your self is much more knocked off when you're severely depressed.
Yeah, I think one is it okay to add just one
Sure.
point? So one of the very, very recent studies indicate that self-blame basically plays very important role in changing depression to major depression and basically disrupting these self-reflective processes which are needed for normal cognitive functioning and also emotional functioning. So that's the only thing that I wanted to share, which might be of interest for some.
Yeah, no, sure. Yeah, thank you. Yeah.
And yeah, we have two more questions if you have time. So one is about the experimental paradigms, whether it could be potentially used in the clinical settings to evaluate treatment outcome? This has been asked by Kavita.
Yes, that is what we are trying to develop further on, because this is a very nice measure without having any confound of familiarity or those kind of issues that we typically see in other research work, because this is a nice way to tease apart several factors. And yeah, in fact, that is what we are trying to develop, whether this could be used as a more efficient diagnostic or at least aid in diagnostic evaluation. Secondly, whether this can be used to look at the treatment outcomes. In Oxford Experimental Psychology and Psychiatry Department, they have worked on the emotional processing battery, which has been used extensively to demonstrate the responses on that emotional processing battery, how that can be used to predict who will improve or who will not improve, or to what extent anyone would improve. But what we are thinking, because they have just looked at the emotion side of the depression, they haven't looked at the self side of the depression, it might be more meaningful to combine emotion and self and then try to work out the treatment responses.
Okay. Thank you, sir. One more question. It's from Divya. She has asked, how does the idea of self impacts one's self-esteem? Or maybe slightly moderating that, or maybe can we understand the neurobiological or the cognitive process underlying self-esteem, or
yes, you can. The short answer is yes. What here we are trying to do, and there are some research which has looked into one distinction that I was talking about, the narrative self versus the experiential self. There are research on that which has suggested that experiential self, which is the momentary self, that has a different representation at the brain level than the narrative self, which is a much more continuous process that has evolved over a period of time. So yes, and that distinction, I and me, they have a distinct representation at the brain level.
Okay. I think, these were several questions that have been asked by the participants. And I'd like to thank Dr. Sanjay Kumar once again for discussing about various aspects of self and emotion. And thank you for a wonderful presentation, Dr. Sanjay. Thank you.
Thank you.
And now we move to the final part of our symposium today. So the next session will be handled by Dr. Zargol Moradi. She's a teaching fellow at the Institute of Psychiatry, Psychology and Neuroscience at King's College, London. She has completed her PhD in cognitive neuroscience and as well as her postdoctoral degree from the University of Oxford. Dr. Moradi's research is based on understanding how the brain interprets the world around it, and how the brain's functioning can be improved in healthy individuals as well as patients. She uses various techniques like Fmri, eye tracking, and cognitive assessments in her research to understand the same. And also, it's very interesting to know that she has various published articles on the area of the in-group and out-group behaviors, the differences between these behaviors among humans. So looking forward to your presentation, Dr. Moradi. And I welcome Dr. Moradi to begin your presentation.
Thank you, Chandana. So I quickly just tell you that today I'm not going to talk about the patient studies that I've done. And I will focus on the effect that in-group biases have on our emotion and cognition. Just to add to my profile, I have a research position at Cardiff University Brain Imaging Center, Kuiperik, where I extended my research in the field of neuroimaging, and that's a separate topic. Okay, let's see if I can actually share my screen here, because I haven't worked with this thing for long. Oh, yeah. Okay, everybody can see the screen?
Yeah, your screen is visible.
Okay, great. Okay, as Chandana already explained, I work at King's College London at the moment, and I actually quite enjoy this. It's a very diverse and good area. And my research or my research students, better to say, are working on the intersection between depression and self and in-group biases. So I'm trying to basically combine my previous research into the new area that I'm working at. So, okay. So you guys, just jumped. So you guys already heard a lot about how in-group affects cognition and emotion. I'm going to extend this to in-group, how our in-group can affect our cognition. So what is in-group favoritism or in-group bias? Basically, we tend to have biases toward ourselves and also the members of our in-group. And these in-group could come from any kind of group, whether it's nationality, race, age, ethnicity, political affiliation, and sport teams. And in fact, most of the research that I've done is in the area of sport teams. I worked a lot with the football fans, which was quite interesting and funny, but it worked really well. It's a proper in-group bias to work on. So in-group bias itself is not actually a bad thing. It can come in different forms, ranging from mild form of preferentialism, like you just prefer your own group as opposed to another group. There's nothing wrong with that. That's okay. And it can also go far to extreme prejudice and discrimination, and that's when it can be a problem. So in this talk, I'm going to talk about the extant research on this topic a little bit. There might be some areas that you already heard about. I'm not going to talk about those very much, so I'm not going to bore you with that. I like to talk about a little bit more about the theoretical explanation of why we show in-group biases and the gap in our knowledge, what we should do about it, and how we can actually improve or be aware of the biases that we have towards our in-group. Okay, so the first study that I've done with football fans was on in-group modulation of perceptual matching. I just put this in forms of papers for you to be able to go and read the papers later. So it might be easier for you to find the details. And also, I'm happy if you like to email me. If you don't have access to the papers, I put my email at the end of this presentation. So you can just email me and I send you the papers. So what I did in this experiment, I replicated what G and Sanjay did with the associative learning task. But instead of using a random shape with title, I used the badge of the team that the participant loved, the badge of the team that they basically hate. Don't ask me why I did that. It was just nice to have this love-hate kind of contradiction in the same experiment. And the third team was the team that they didn't care about, so-called neutral team. So I gave them 3 random shapes and asked them to learn how each shape is associated with each team, and they went and did the same task, similar results. So it basically replicated what G and others found in self-modulation of perceptual matching, i.e. they showed better learning for the association for team as opposed to the rival team or the neutral team. And what happened, what made my study interesting, I got actually a media cover for this, which was quite cool. So I went to the actual stadium, and the team was Oxford United because I was in Oxford. So I went to the field, and before the match started, I got them, well, obviously I prepared a testing room in the hotel adjacent to the stadium. But what they did at the height of their emotions toward this match, at the height of their hate toward the rival team, they did this task. So I did a field experiment, which is quite rare. But then I got the same participant to the lab and they did the same task and I replicated it. So that's what makes this study unique. So whether you do it in a natural environment where this intergroup conflict happens or in the lab with all controlled factors, the study shows the same result. So next, I wanted to know whether you can actually override those associations that already are there. So for this experiment, I used, and this is the European Journal of Social Psychology. So I used the rowers team of Oxford University, and I set them against Cambridge University. And the third neutral team was Birmingham University. So what they had was that they learned associating the color of their team. So Oxford has a certain blue, kind of dark blue color as a team color for rowing and for everything. So if you've seen the Oxford logo, it's dark blue. And Cambridge is kind of light blue and greenish, kind of aqua green. So these are like already learned association. And what I did, I get them to associate these original colors with a random shape and do the task. That was fine. Then I wanted them to overwrite this layering. So I swapped the colors. Now instead of Oxford being dark blue, it was aqua blue. And I get them to do the task again. And although there was a new association, which was strange, it was the color of the rival team, they still did better for Oxford. So we can override these associations. And the reason I did that was because I was interested to see whether we can change this association in real life. So the association that we normally hear about, like associating a gun with blackface or negative feelings or negative words with out-group members. So these are the associations that we learned as a member of a certain society. But can we change it? So that was my question. And that's why I did this experiment. And these results show that you can actually change it. You still get the in-group favoritism, but you can change the actual association that is there. And that's a very important message for how we can change our societies and how we can reduce negative feelings toward the member of out-group. Again, you can go and look at all the information in each of these papers. So next, I wanted to see whether in-group association affects low-level attentional mechanism. And by attention here, I mean visual attention. So I just wanted to know if something is related to my in-group and it captures my attention or not. Simple as that. So I did, and well, it sounds simple, but in practice it wasn't that simple. So I did a eye tracking experiment by putting the badge of in-group and out-group at two different sides on the horizontal axis. And on some of the trials, I asked participants to look at the target. And on some of the other trials, I asked them to look away from the target. And it wasn't like a block experiment. They didn't know beforehand whether it's going to be an anti-saccade, meaning looking away, or saccade, meaning looking at. But they had a cue, so there was a cross in the middle of the screen which turned to green, and it meant you are going to look at the target that appears afterward, or a red cross that meant you're going to look away from any target. And you know that we are not actually very good at anti-saccade or looking away. Whatever appears on the screen, we tend to look at it first. So that's why we make directional error. It means that instead of looking away from something, we look at it. So what I found interesting was that the directional errors were less for outgroup, meaning that they were ready to look away from outgroup as opposed to look at it. And this was one of the very early evidence that we found that for very low attentional mechanisms, such as just looking at or looking away, being a member of a group affects our behavior. So there you go. Finally, I looked at how the brain function is related to in-group and out-group relevance. So I got my participants, and it's worth noting that I used mostly the same group of participants in most of my experiment, just to keep it reliable and to be able to conclude on the overall picture, what's happening at different levels. So I got my participant to lay in the scanner. I got a resting state fMRI, and what you see in resting state is that there are some intrinsic connectivity between different areas in the brain, which is differ from individual to individual. So that's there, whether you are I don't know. It's kind of the functional connectivity signature for a person. Maybe signature is not the best word. It changes from time to time, but there are some pattern that you can see. So I had them to go through the resting state fMRI. They just lay there. I just got some imaging, and then in the middle of that, I get them to do the task, and then I looked at the functional connectivity again. So what I found was very interesting, because in the participant, let me just move this. So in the areas such as insula here, both side, and prefrontal medial, anterior prefrontal medial cortex here, people showed a stronger connectivity after they learned about these associations. And the more, the higher the prejudice, the higher these kind of intrinsic functional connectivity were. And when I interviewed them again, well, they explicitly said, oh, every time I saw the badge of the out group, I just got so angry. And we already know that in some of the experiments, the co-activation of insula and anterior cingulate cortex relates to anger. So they learned it, but every time they saw it, they got angry. So that was very interesting, how out-group provoke specific emotions even without you doing something, even just looking at the resting state before doing this task and after doing this task. And we know that out-group bias or in-group favoritism is not something that is fixed there. We learn it, and there's always a context. So sometimes in-group becomes more important for you, and sometimes out-group becomes more important for you, because you have to pay attention to their action and you have to be ready to react properly. But what we've found normally is, just connecting to the previous slide, is that most of the time when you see out-group, it provokes negative emotions such as anger or fear. So in one study, very interestingly, in women who wear niqab, the participants from other religions, they showed faster response to the faces with angry or fearful expressions. So this is kind of a land association that we already have, and we are prone to show these negative associations to the member of outgroups. Similarly, so if you do the block shooter bias task, even though if you get the participant to learn to associate the gun with the white face and tool with the black face, they still show the bias, the negative bias for the outgroup member, which is the black face here. So it's quite a tough association to get rid of, but we will discuss how we can do it and why we should be more aware of it. So another work by my colleague Yankovskaya, which later was extended, and I collaborated on this, was again the identity and facial expression. So if the identity of the face with your own ethnic group, you tend to recognize the positive expressions as opposed to the negative expression, and so on and so forth. So these are just to confirm that, okay, biases are there. We have negative bias to the out-group and positive bias to in-group. But it can happen at different levels. So it can happen at lower levels of attention, like I showed you in the eye tracking experiment. It can also happen at decision-making, like the shooter bias. So the lower it happens at, if it happens at lower attention level, it is more difficult to get rid of it. And also, one more important thing is that there is not that much work on how the exposure to the group members or intergroup contact can affect these biases. So if you already have this negative bias, if you think this specific ethnicity have this negative trait, but if you get to know them, if you make friends with that group, obviously you become more flexible towards losing that bias. But there's not that much work. So this is one of the gaps that we hope to fill in the future. But how does this exposure or contact, intergroup contact, will help us to reduce these in-group biases? Three main pathways might help us to reduce these biases. So if you know more about the members of the out group. So you increase your knowledge by having more contact. It can help you to reduce the bias. We normally avoid out group, and we normally don't have much contact with out group because we have less knowledge. Also, not knowing them creates anxiety and feeling of being threatened in us. So if we decrease the initial anxiety, it can help us to start having more contact with the out-group member. And finally, if we improve the empathy and perspective taking, even if it's just imagination, even if it's just stimulating these kind of mental processes, empathy and perspective taking, it can always help to reduce the negative biases towards the outgroup. But why do we develop these biases? So they start very early in our life. Some studies show that even like children tend to think egocentrically and rigidly about things, and this caused them to show outgroup negative bias in age around 4 or 5, so it starts very, very early. One of the most important things is that because we evolved in different groups, we tend to be more cooperative with our in-group, and that's why we kind of avoid out-groups and we think negatively about them. Also, one of the areas that is important to take into account is that when we see someone, if I see you, I automatically categorize you into, categorize myself and you into 2 groups or 1 group. If you're from my own country or kind of gender or similar age, I feel more similar to you. So self feels more similar to the other. Therefore, I can put them in 1 group. So you become a part of my in-group rather than out-group. So it's kind of that the mind has this tendency to automatically put people in different groups. And that, to avoid that, we need cognitive flexibility. We need to be aware of this, and we need to be cognitive flexibility. And also, as I said earlier, because there is competition over scarce resources, and nowadays is even more the case. And because we have less knowledge about our group, it creates anxiety, and these factors together makes us more prone to having negative biases towards outgroup. So so there is a problem with this slide, but so I wrote this kind of commentary review paper on how to look at in-group biases from the level of society to the level of brain. And I just briefly tell you about the conclusion that we made going through many studies. It's been published in Social Neuroscience. It's not too long, so if you are interested, have a look. Or if you can't find it, just email me at sarah.moradi@kcl.ac.uk. And these are not uppercases. I don't know why they appear uppercase here. So the conclusion was that if you go through different studies that looked at in-group and out-group, is that the information relevant to in-group could raise saliency, so they become more important for our perception and cognition. That's why we have this positive bias towards in-group. But remember that it's always very context dependent. If there is rivalry, you get more vigilant for the out-group information, and the out-group information becomes more salient. It doesn't still create positive bias, but it creates more saliency. So as I said, if you are in the context where the emotions are deeply involved, normally the group relevant associations or stimuli create negative emotions about outgroup targets. And it's been shown across different neuroimaging studies and behavioral studies. So there is a direct relationship between negative emotions and negative biases towards outgroup. There are many brain areas involved in this, so I'm not going to confine this to the insula and anterior cingulate cortex, no, because it depends on what context you are testing your participants in the lab setup, but mostly it affects the attention and emotion networks. So to be honest, that's not the problem that we are facing now. The problem is why we show these negative biases. And for example, in the current situation where most countries should show collaboration with each other to tackle this international problem of virus, we don't see that, and it's more nationalism rather than globalization in solving a problem that we all are facing with. So in reality, that's what we are facing with. So in my view, it doesn't matter which areas on the brain are involved. Of course, it matters from scientific point of view, but at the end, we really need to find practical solution for real world problems. So what we just need to remember is that these biases are not fixed there, and there is hope to change them. We can create shared goals for members of different groups, and that might kind of give us flexibility to kind of to some extent override these biases. And we really need to, in real life situation, we really need to focus on creating shared reward, shared goals to be able to get over this problem. So I didn't want to talk too much. I hope I haven't been so fast. I was just aware of time and I couldn't see my timer. Anyway, thanks everyone for listening. And I'd just like to thank the Wellcome Trust and Liverhulme Trust for supporting my experiments. Okay, how was I on time? I mean, was it too fast?
You are good. Yes, you were good. Perfect timing. Thank you very much, Dr. Jargol Moradi. I'm still waiting for questions, but while we wait, I just have a couple of thoughts to share, and then would like to get your comments. So your presentation made it really made it clear how some of our biases are mostly influenced by our developmental, evolutionary, some of the conditioning, a lot of factors. And it looks like these biases rely on mostly like the bottom-up processes, right? Where it is more emotionally laden. And when you think about how do we manage these, like how do we overcome these biases, they all are relying more on top-down processes, like more like empathy, thinking in big picture, compassion. So it sounds to me like very contradictory, like how you would intervene these, like when you said it is very difficult, yes, I do agree, but your strategies, like how you came up with, like having common goals, educating people and helping them familiarize with group differences seems to be a valuable suggestions for these to intervene. Your topic is one of the most important topic at the international level and national level, because we all face some of these biases due to race or gender, or in India, mostly caste and sect, you know. So the findings that you have probably, you know, like coming up with modules that can help with more being educational in organizational and school institutions. Definitely.
The problem is, to be honest, sorry to disrupt you, the problem is that the governors or the funding bodies, they don't invest on proper interventions. So they might so I was actually talking with one of my colleagues, and he works in UN, which is one of the top areas that you basically think, oh, okay, they have to have the answer. It's UN. And so what they do is basically they ask their people to just go online and learn some online courses on empathy and stuff, which is like, I don't think it's the answer. It's just to say, okay, we've done this, we needed to do this, and we've done this. So real investment on this topic hasn't been done from the governors or from the society or even from the companies, because if you think about this whole vaccine thing or virus thing, could have been much easier to kind of manage it if we were thinking globally from the start. So yeah. So, and to respond or to comment on your thought on bottom up versus top down, so I think bottom up processes happen when you unintentionally or involuntarily learn something or become conditioned to something without paying attention. And it kind of reinforces something. So it reinforces some of the associations that we have, like negative associations for outgroup, etc. But to kind of overwrite it and or at least weaken it, yes, you can go bottom up as well, like create some positive associations, but that has been shown that doesn't work in long term. So you have to have this kind of voluntarily flexible, cognitively flexible system to be up there and to be aware and kind of control every aspect of your action to be able to do it until it becomes automatic and can work bottom up.
A lot of work on our prefrontal cortex until it gets to more at a conditional level.
Yeah.
Thank you. And I have a question on the chat. I'll just read it to you. This is from Jay Sri Das Gupta. Thank you for this very interesting presentation. Is there work that has looked possible neurobiological reformation where extreme bias can be harmful, and what neuroethical implications does this have?
I don't know any study on top of my head because it's kind of a sensitive topic to look at. So I was like very interested when I was doing my master at UCL to go and work with offenders, basically, to work on this topic, but I didn't get ethical approved. So I don't know any study with like neurobiological change in severe cases, if you like. No, I don't know, but I can search and see if there is any new work. I doubt it, but yeah, there's so many obstacles for that kind of study.
It has strong social implications, so it's understandable. There's another question from Divya. How can we teach students not to get affected by these negative biases, which is present in the society, because these biases lead to depression in many? What are your views on this? how to face them confidently?
Yeah. So one thing is to kind of be biased towards other people. One thing is to be the target of these bias. I think question is more, as I understood, is more about maybe more aspects, both aspects, not just being a target or having these biases toward others. So am I right?
So the question is, how do we teach students not to be affected? Like how do we teach students to be?
So it actually needs a hard, continuous effort. Like, as I said, it needs a lot of cognitive flexibility. So I think to start with, without directly focusing on these biases, we need to focus on cognitive flexibility trainings in other areas, not directly. So if you go and tell a student, oh, okay, you shouldn't be affected with this biases, no one listen to you. So for example, when I do my teaching or projects or small group tutorials, what I do, I put the students from different ethnicity background. And one area that we came up with is international evenings. So you really need to do practical work. So these international evenings will help them to first give the knowledge about their ethnicity, get you more knowledgeable about my background. So I'm from Iran. So many people might hate Iran. I don't know, because of the government, so many things. But when you have this international evening, so I show you my culture, I tell you about my food, I tell you about the dance, music. So there are many bad things in any culture, but there are good things as well. So I as a teacher, as a person who can give students some educational about I don't know, educational information about other social groups, I create a atmosphere in which people from different ethnic background can share positive information with each other. So you shouldn't go about these problems directly. You create an atmosphere in which they can interact, they have positive interaction, and they might even have shared goal, like they cook together or whatever, or they prepare a song together, they pick a song together. And this just helps to even out that kind of biases or things like that. I think things like this should be included in any kind of educational activity. Even though you do like lectures, you also do this kind of enrichment activities in which you give them a chance to interact in a positive way. I think that's the solution, to be honest, not just to tell them, oh, you shouldn't have this bias. No one listen to you.
Yeah. Thank you. We have one more comment, but because of the timing, I'm gonna, jump to the concluding remarks. Thank you so much, Dr. Jargol Moradi, taking your time to share these findings. They have like very great implications, like you said. I can see it's frustrating that we know so much, but we cannot intervene into these.
Exactly.
I'm sure we can hope that some of your findings will be, transition to some implications and interventions. Thank you.
Thanks so much for inviting me. Great to know you all. And I hope people just learn some new stuff and enjoy this talk.
Absolutely. I have no doubts about it. So thank you all for joining us for this for the fourth symposium of our series. We had wonderful speakers today from our renowned cognitive neuropsychologist, Dr. Glenn Humphrey's lab. All the three speakers today were part of his lab at some point. Dr. G. Sui, Dr. Sanjay Kumar, and Dr. Jargol Moradi. They shared their wonderful work related to self and its impact on emotional experience, social implications, as well as the neuroanatomical substrates that support our self in normal brain and how they are altered due to neurological conditions. Now I turn this over to Jay Sridas Gupta, one of our conference organizers. Dr. Jay Sridas Gupta. Let me see.
Thank you, Kavita. So I'd just like to mention that on behalf of the organizing committee of the International Symposium on Contemporary Trends in Clinical Psychology Across the Lifespan, I'd just like to just share a quick note of thanks. It's really been a very interesting and a very informative symposium series. We've had 4 symposia across the last month, as Dr. Kavita was mentioning. And these have ranged across areas and topics, some of which are specific to a particular stage in the life course. And there have been others which have focused on important topics that are actually relevant for, and very critical issues across the lifespan. The first, on the 5th of February, was on technology addiction in children and youth. The second, which we had on the 12th of February, focused on relationship issues and emotional abuse. The one that was held on the 19th of February highlighted perspectives from neuropsychology. And of course, today's symposium has looked at a really interesting and absolutely fascinating topic of the self in cognitive neuroscience. And in case you've missed any of these or been unable to attend them, these will be available for viewing on the YouTube channel and with the links that we have shared with you earlier. But I would really like to extend our thanks to all the speakers for each of these symposium. I mean, one of the interesting things has been that these symposia have not only focused on very interesting and very recent research findings, but they've also gone on to talk about the clinical implications and applications. And I'm sure that this has been incredibly interesting and beneficial for all of those who've joined in. So I would like to really extend a very big thank you to all our speakers. I'd like to also extend a lot of gratitude to our symposium moderators. They've really managed to encourage a lot of engagement with our participants, despite this being an online format. And so I'd therefore really like to thank them. Of course, one of the advantages of the online format is that we're able to transcend geographical boundaries and logistic limitations, which has encouraged participants to join in for the symposia series from not only various parts of India, but also from different parts of the world. So I'd really like to thank all the participants for joining in and really making this symposia very interesting and a success. And we really want to also appreciate the feedback that we've received from several participants. So thank you for that. On behalf of Samvedna Senior Care, I would like to extend our thanks to PSG Institute of Medical Sciences and Research for this collaboration, which has really allowed for such a terrific scientific exchange. And also a big shout out to the Samvedna team for their support in organization. Before we close, I'd just like to make one announcement about a request for certificates. If you do require a certificate, please email us with your request on the email that you've received the registration details from. We will also be sharing with you a link for feedback, and we really would appreciate feedback from the participants. And this will be really helpful for us as we plan and organize programs, events in the future. So with that, I'd like to once again thank all our speakers for today, as well as the moderators and our participants. So thank you very much for joining in, and a very good evening to everyone.